Kristi Thompkins on. She's a licensed naturopathic doctor practicing functional medicine in the greater Sacramento area in Northern California. She treats people of all ages. Her specialties involve helping women and men with their hormones, including peri and post-menopause. She helps with PMS, andropause, which is when men go through menopause, thyroid conditions, adrenal stress, and many other conditions such as gastrointestinal symptoms, allergies, anxiety, depression, and weight loss support. So welcome, Kristi.
Hi, Heather. Thank you for having me.
Oh, I'm so happy to have you on. It's been too long. So one of the coolest things about being a naturopathic MD like Kristi and I are is that or Dr. Thompkins, I'm sorry, right? So we address the unique needs of each patient and we investigate the root causes of disease. And Dr. Thompkins uses treatments such as therapeutic nutrition, botanical medicine, natural hormone replacement therapy, which I want to talk a lot about today. And then she uses professional quality supplements and motivational lifestyle counseling to help patients heal their own bodies. And so you can see why I'm so happy to have her on, because that's the philosophical, crux of what I believe that we do. And so she does a lot of testing, and as you've heard a lot, like we do at NaturopathicMD is our sister site to this podcast, and we have a lot of functional tests available for people that aren't necessarily near a functional medicine doctor. So Dr. Thompkins got her naturopathic medical degree from the same place my husband did, which is Bastyr University in Washington. And she has a bachelor's in science in nutrition from California State University in Chico. So she also knows how to have a lot of fun. So an essential foundation to excellent health and longevity is, these pieces. And so we want to talk with her today about how she goes about in her practice. And if you want to join her at her practice and you're in the greater Sacramento or Northern California area, you can go to www.drkristi.com. Doctor is spelled out and it's Kristi with a K. And we'll talk a little bit more about that. So that was a long introduction. Welcome.
It was a long introduction. Thanks, Heather. I'm happy to be here.
So we met, I don't know, probably like 4 or 5 years ago-ish. And it's when you had come back down from Seattle, the greater Seattle area, to come back to lovely Northern California. And you at the time were doing a lot of bioidenticals as far as like practicing. Well, you came out of one of the most famous, doctors in functional medicine's practices in Seattle. And so you did a lot of work there, but also building a practice here, we started with bioidenticals. And so I want to concentrate on that just for a little bit, even though I know it's not something that you do exclusively. So what would you describe as far as your philosophy with hormone replacement?
So, every woman goes through changes. Every woman goes through menopausal changes. And for a lot of women, it starts in their 40s. For some women, it starts around age 50. For some women, it starts in their 30s. And I don't think a lot of women are prepared for the changes that they go through. And I think it catches a lot of women by surprise. And probably one of the first things I hear from my patients is that they're gaining weight. They are a little bit more tired. And this might start at age 38, 39, 40, early 40s. And then as women start to approach 50, those symptoms become a little bit more severe. It starts to be maybe hot flashes, night sweats, change in sex drive, lots of other symptoms. And with bioidentical hormone replacement therapy, I think a lot of times that can mitigate or ameliorate some of those symptoms. For some women, they don't want to do hormones. They want to do more natural hormone support. And so for those patients, I would do botanical support, using herbs, using nutrition. We talk a lot about diet, lifestyle, changes that can be made to help with those symptoms. For those patients that are wanting a little bit more assertive treatment, I think the bioidentical hormone creams can help these patients feel so much better. Whether it's bioidentical estrogen, for some women, it might be bioidentical progesterone to start, maybe a little bit of bioidentical testosterone. And it's the effects are profound in how women feel. And the fortunate thing about today, today's society is that we have compounding pharmacies that can take those bioidentical hormones, put them into either a topical cream form, or in some cases a troche or a capsule or a tablet form, depending on what's best for the patient. And it can have amazing results for these patients, these female patients, and then of course male patients too would be testosterone.
So we talk a lot about bioidentical, and I think that you and I take for granted what that means. So can you explain the difference between like a bioidentical estrogen and something like Premarin? Because there's a lot of research showing that, you know, those conjugated estrogens can cause a lot of negative side effects. My grandmother was on Premarin for 50 years. And when the research came out showing that it increased heart disease, her MDs freaked out and put her through menopause at the age of like 82. And she had tolerated it very well, right? But there are these side effects associated. So what's the difference between that and bioidenticals?
Yeah, that's a great question. My mom was on Premarin for many, many years. She had a complete hysterectomy, and back in the 80s, her doctor put her on Premarin only, which is basically the estrogen that comes from pregnant horses urine and made into a tablet, which is technically that's natural, right? Because it's coming from an animal, but it's not bioidentical to humans. So bioidentical would mean that typically the hormones come from a plant botanical source. It's either the soy plant or the wild yam root plant. And so plants have phytosterols, which is kind of their version of cholesterol. We produce cholesterol because we're humans. So they have these phytosterols that contain the ingredients, so to speak, the phytonutrients to make bioidentical hormones that typically are transferred or manufactured by a compounding pharmacy. So it's the same biochemical structure as our own hormones. So our own hormones, estrogen, progesterone, testosterone, DHEA, we make our own from our ovaries, and for men, it's their testicles, and sometimes from our adrenal glands too. Those are our own bioidentical hormones, but in the case of the plants, they are bioidentical, biosimilar as our own structure, as our own hormones. And so the body, in that sense, takes it in very, very well. They're still hormones, whether it's your own hormones or hormones that you're getting exogenously through a compounding pharmacy, you would still need to do testing. You still need to make sure your levels are safe. If I'm going to be prescribing hormones for patients, you still need to make sure that it's not a high dose, even though they might be bioidentical. So, but with that, people usually tend to resonate with the hormones. They have a profound effect, and patients do very well on them. And it's not synthetic. It's not from a horse. And I just think the body just assimilates it much better.
Yeah, I don't believe that they've seen any of the same negative side effects with bioidenticals as they do with the other conjugated pharmaceuticals.
Well, with the conjugate, yeah, in those cases, sometimes it can increase your risk of stroke, heart disease, blood clots. It can, it can still cause weight gain.
Mm-hmm. Sure.
And it can still cause headaches. But, like with the bioidentical hormones, too much is too much. If it's too much for your body, you're going to have weight gain in some cases. In the case of testosterone, you might have more acne breakouts, you might have more aggression, you might have more hair loss, even though it's bioidentical. So, but yes, generally, and the way that I prescribe hormones is pretty conservative. It's very safe, and I don't usually prescribe high doses for patients. So, and I do recommend testing, preferably twice a year, if not once a year, but usually once or twice a year, just to make sure the levels are safe.
And that brings up a really good point, because I know that there are a lot of practitioners out there that just go on symptoms. They don't even do testing.
Right. In fact, I just had a patient in my office just this morning, and he was prescribed androgel, which is the bioidentical testosterone, but it's actually a pharmaceutical medication. So it is by prescription, of course, as all testosterone is. But it's made by, I don't know who it's made by, but it is a patented, and they must be patenting the delivery of androgel. It is a bioidentical testosterone, but it's a gel, and they must be patenting the way that it's delivered into the body. But he has been taking it for 5 years, 6 years, 7 years. And the last time he had testing was 2 years ago. So And I questioned him. I thought, wow, that's really interesting that your doctor would keep renewing the hormone prescription without having you get tested at least once a year. And that could just simply be doctors are very, very busy and they don't have time. And these people slip through the cracks and they've been on this testosterone cream, and maybe his levels are too high. Maybe it's too low. Maybe it's not working anymore. So just for not only blood levels or urine testing, which we can talk about, because that's another favorite way of testing hormones that I like. Not just the levels are safe, but also symptoms, because sometimes the lab tests don't always match the symptoms. And sometimes the lab tests are normal, but the symptoms, the patient's having symptoms that it's too much or too little, vice versa. Sometimes the symptoms are completely fine and they are not exuding any symptoms, but the lab tests are showing something else. So that's why it's really important to meet with the patient at least twice a year to make sure that they're okay.
Yeah.
And safe.
I also really like bioidentical prescription because it's more personalized.
Yeah, it is. And you can change the dosage. You can put it into a cream. You can change even the cream base.
Right.
You can recommend where to apply certain creams that maybe are absorbed a little bit better. You can put them into a syringe, a toppy click, like, a troche, like we talked about earlier. So yeah, it is very, very personalized and it's very unique to the patient.
Mm-hmm.
Yeah.
That's, I think, what I like a lot about it. So you touched on one of my favorite tests that I've been running. And so tell me about the urine testing that you do for your hormones.
So there's a few different labs that are out there that actually that do so there's a 24-hour urine test that I used to work with Dr. Jonathan Wright up in Seattle, Washington at the Tahoma Clinic. And I learned so much from him and his team of doctors on bioidentical hormones, prescriptions, testing. One of my favorite ways of looking at the hormones is a 24-hour urine test that will look at the steroid hormones over a 24-hour window. It's typically done at a certain time of a woman's cycle if she's still having a period. Typically that's done around day 19 or 20, that's usually the peak luteal phase when women are usually producing the most progesterone. So that time period tends to show the most representative levels of progesterone. It'll show the different steroid hormones like estradiol, estrone, estriol, progesterone, DHEA, testosterone. And what I really love about it is it looks at all the corticosteroid adrenal hormones too, cortisol, cortisone, and all of the cortisol metabolites, aldosterone as well. It looks at a few different enzymes that are specific or that are involved in hormone metabolism. And I really do think that that's a lot more sensitive and accurate at picking up the levels compared to a one-time blood draw. Sometimes the blood draws are very specific and certainly more convenient and less expensive, and many of those are covered by insurance, and that's great if that works for the patient, and I'm willing to work with the patient for that. The 24-hour test, though, I think just shows so much more information.
Right.
Now, with that, they've come out with testing that would be called a dried urine hormone testing, where it's 4 times a day. And the Dutch test is one. I think that's precision analytics.
And Dr. Wright actually has his own now.
He does. And that's another one. So because I used to work at the Tahoma Clinic, and actually briefly for probably about 6 months, I did work at Meridian Valley Lab as a doctor consultant.
Oh, nice.
Interpreting test results for patients. And so their lab is affiliates. Dr. Wright's medical director of both. So they have their own dried urine hormone testing that I've used with patients. And that one's also, it's also very sensitive and accurate, but instead of 24 hours, obviously you're doing it 4 times a day, first thing in the morning, noon, I believe it's 5 or 6 p.m., kind of dinner time, and then right before bed. And what I like about that one is you do get to see the normal circadian rhythm, or you get to see the cortisol, the peak, and then the drop, and then the definite significant drop right before bed. So that is going to show where somebody's energy is lying. I mean, some people have great energy in the morning and they crash in the afternoon. Some people are really dragging in the morning, have very, very severe adrenal fatigue, but they get their second one later in the day or sometimes even at night. So I think it's great for that, especially people with insomnia or sleeping disorders, usually you can see that cortisol peak way too high right before bedtime. So it depends. I mean, some patients, they don't mind doing the 24-hour test. For others, it's just simply more convenient to do it 4 times a day, be done with it. So I usually try to meet the patient where they're at as far as what's the most convenient and also affordable to them as well. Yeah.
Right. And I mean, we can make judgment calls based on symptoms, obviously, but it's always nice, in my opinion, to have, I'm a tester. I like to know because
yeah,
everybody's a little bit different. And as you said, you can't necessarily just peg people. I've had people in the office where I'm like, oh, you're so estrogen dominant, right? Like you're so estrogen dominant. And then it comes back and it's like, oh,
yeah,
I guess you're not.
right.
And it's also really interesting because with those urine tests, I do the Dutch quite a bit. And with that one, you can see like which enzyme system is like slow and like how to speed it up. Where do we have these different imbalances in the process so that you can support people's healthy production, especially earlier, pre-menopause or, infertility, PMS and that sort of thing. So I've really been enjoying that one. That's the new test I'm nerding out on.
And you said, I think I heard recently that you did this on yourself. Was there some, have you gotten the test results back yet?
No, I have not done it yet.
Okay. Have you ever done a 24-hour urine test or any type of urine hormone testing for yourself?
I haven't done the, no, I haven't. I've done predominantly blood. I've done a lot of saliva, but I haven't done the 24-hour urine.
Yeah. So when I worked at the Tahoma Clinic, I did do that test. I probably did the test once a year. And I did this early on when I first started at the clinic. And this was shortly after I had graduated from Bastyr, and I was I think at that point I was still a little bit stressed, going through that medical school program really stressed me out. And I had a lot of things going on in my life, and I did have some sleep issues. I had trouble winding down at night. I had trouble, calming my mind. So it would take me a long time to fall asleep. And I remember doing that test early on, and it showed my adrenals were ridiculously high, which I have to say, that's a good thing. When your adrenals are producing a lot of cortisol, that still means your body has the vitality and the resources to produce those hormones. It's when somebody is chronically stressed that you start seeing those hormones drop too low that you have to be concerned. And that's where adrenal fatigue comes in, or adrenal fatigue has set in over a period of time. But I remember my adrenals were really, really high. And then over a period of time, taking adrenal support, adaptogenic herbs, getting better quality sleep, feeling like my life was a little bit more stable, then I started to notice that the cortisol levels started to drop a little bit, well within a normal reference range. But one of the things that I do see with regard to adrenal stress or chronic stress is that if it's too high for too long a period of time, it'll actually start to suppress the progesterone. And that's one of many hormones that we look at on the test. And when progesterone starts to drop, that's when you start seeing irregular periods and more of the estrogen dominant symptoms like you talked about, or that we can talk about today. And then, there's a lot more PMS anxiety that comes about, PMS irritability, sometimes heavier bleeding for some women. So in general, I think it's a great test. And if you could do something like that once a year, every year and a half, I think that's, it's great to see it as a patient because we're patients too, obviously. Right. And it just helps to see over time how your body's changing.
So I actually just had a lot of that happen because I was under a tremendous amount of stress. And we talked about this actually, where I was having hot flashes at night and I would wake up with anxiety. My cycle shortened, and it's called the pregnenolone steal in some ways, right? Because pregnenolone builds progesterone as well as cortisol. And so if the cortisol is using up all of your pregnenolone to try to keep you from totally freaking out,
surviving,
right, to keep you surviving, then your progesterone goes down. And then, estrogen can cause all kinds of nasty symptoms when there's estrogen dominance. Do you want to talk about that?
Yeah, well, you just, in some cases, like you said, sometimes you think somebody is estrogen dominant, but it may not be that they're estrogen dominant. It's just that their progesterone has dropped too low. And so it's giving that impression of estrogen dominance. And for some women, that could be fibrocystic breast changes where there's not a progesterone binding to those breast receptor or progesterone receptors. It could be, like the sleep problems, the anxiety, the irritability, the PMS, the bloating that women get sometimes, the cramping. And so but it's the body's way of protecting itself. So if you're under stress, work stress, marriage stress, job stress, financial stress, if you're under any kind of stress, that's your body's way of saying, this is not the perfect time to bring a baby into this world. If you are still within the reproductive years, it's your body's way of saying, okay, we're going to have the adrenal glands take center stage, and we're going to try to survive because you're in the fight or flight mode, right? And so that's your body's way of protecting itself. And it's going to put having a baby on the back burner. It's actually I love how the human body works. And I'm probably like you, I'm continually amazed at how it's able to juggle so many things at once. And it tries to keep your best interest at heart. It tries to do what it thinks is best for you at the time. And it's just amazing how it does it all. There's so many different reactions happening at once. And it's your body's way of saving you, really.
It's amazing how resilient the human body is and how much we can abuse it before we really start to see the negative effects of it. And so I devised this podcast because I wanted to teach people how they could, drink wine and work hard and not take perfect care of themselves and yet still be able to be healthy through, trying to make real life kind of come together with, natural functional medicine to insulate from negative symptoms. And so that was a big part of it. And sometimes you have to stay up late, right? And sometimes you have to work 2 jobs. And so how do you protect the body during that piece? It's the secret, I think, to having fun and aging well.
Yeah. And, nobody has a perfect diet. Nobody has a perfect life. There's no such thing. Not everybody's able to exercise 5 to 6 days a week for an hour. It's not always possible. I have noticed that when we're younger, and probably everybody can vouch for this, when you're younger, you can, so to speak, abuse your body a little bit more. You can have a little bit more sugar, a little bit more unhealthy foods, a little bit more alcohol. You can indulge a little more. And yes, you're going to still feel the effects of that, but your body is a lot more resilient because of the hormones, because of your thyroid, because of your human growth hormone and your testosterone and your other and your adrenals typically are much stronger. It's that I start seeing people really crash and having really severe hormone imbalances after the age of 40 and definitely after the age of 50. You can't abuse your body like you did when you were 21, when you're 51 or 61, because you're going to feel pretty terrible the next day.
Right.
And I think a lot of that's due to, changes in the detoxification pathways, changes in your liver, changes in your hormones. Your metabolism naturally goes down. Thyroid hormone naturally goes down for a lot of people, specifically for women in their 40s. And that's when you start noticing just things, you're not recovering quite as quickly as you used to. Yeah.
And I think there's a big piece of it too with a lot of the cofactors that we need in order to keep everything working are nutritional. And a lot of our nutritional statuses are just deranged because our food supply isn't as good as it could be.
Right. And, we can try to do the best we can with the food that we have and the access to organic fruits and vegetables as much as we can if we're able to afford them. I think that the cost difference between conventional versus organic, I don't think it's as large as it was many, many years ago. I think it's pretty affordable. You don't have to necessarily shop at the high-end grocery store. You can even get organic, fruits and vegetables at mainstream grocery stores. And so, yeah, making better food choices. And a big favorite of mine is actually exercise. And I think the exercise, eating healthy is great, but if you're eating healthy and you are sedentary all day long, several days in a row, weeks in a row, months in a row, that's really going to take a toll on your body. And your body is going to start gaining weight, even though you might be eating healthy. I think the exercise really does, a million different reasons, not just weight loss, but it does help improve hormone sensitivity. Obviously, detoxification, but it's a big stress reliever too. And I think for a lot of people, it gets rid of that excess cortisol, right? The body excretes what it doesn't need.
Right.
And it makes everything work better.
I mean, it's good for everything. I don't think you can't have a wellness protocol or a way of moving forward to improve someone's health without exercise.
Yeah.
I saw something recently that showed that exercise actually beneficially changed the microflora in the gut, which is the healthy bacteria in the gut by itself, with no like fiber or anything. It was just the exercise controlled for by itself. And also, I mean, what are the two huge problems that, Americans have? The digestive issues and sleep issues. I mean, and both of those, first line treatment, exercise.
Yeah. I mean, think about, when you exercise on a regular basis, how much easier it is, how much usually more balanced your digestive system is, you're more regular, things just seem to work a little bit better. There's less bloating. I think, and also that is interesting about the gut flora without needing to take a probiotic. That's fascinating, but it helps with that cell turnover, right? And it helps create new cells. And that includes our intestinal cells and the good bacteria. That's, I wish more people, unfortunately, a lot of people don't have time. And I really, you can try to squeeze in what time you can, or you can try to create opportunities to work out a little bit better. But when you're working a full-time job and you have several children and they're in school and you have sports that you have to take your kids to and academic responsibilities and job responsibilities, I think it's really challenging. And I have a lot of compassion for my patients. And when they try to do the best they can with the stress they're under and their overwhelming schedule, I usually tell people, try to do something. 30 minutes is better than 0 minutes. I always say that. Or 20 minutes, 25 minutes. It's always better than 0 minutes. So if you can just do something first thing when you get home, or if you're a morning person, I'm not. Get up at 5 in the morning or 6 in the morning, get it done, because it's better than 0 minutes.
So what's your favorite form of, because we're talking into self-care, right? And we both have those schedules that make it difficult to really prioritize everything that we know we should be doing, right? So what are you currently doing for self-care?
So I'm a big advocate for exercise. So I do recently, I joined a gym in my area about a year ago. I love this gym. It has these classes that incorporate cardiovascular and muscle strengthening exercises. And it's about an hour. So it's a little bit of cardio and weights, or maybe sometimes using your own body resistance, push-ups, sit-ups, lunges, squats. And it's in a group setting, which I love. So for me, I love the cardiovascular because it helps. I feel like it's a really big stress reliever, but it also incorporates the muscle strengthening, which I have to say in the last year, my muscles are stronger. I've been an avid exerciser for many years, but in the past I would do like exercise DVDs at home, and those were great. And those were convenient for my schedule, especially when I was in school or when I had more of an unpredictable schedule. I can slip in a 35-minute or 45-minute or an hour exercise DVD, and it was great. But I found after a certain period of time, I wasn't challenged as much. My body kind of hit a plateau. I was able to maintain, but it was until I joined this gym that shifted everything. It just changed it up, and it knocked it up a few notches as far as the complexity and the challenge. So I've noticed that my upper body is stronger. I can do more guy push-ups, the regular push-ups, whereas before I could do maybe 10 of the girl push-ups, on your knees. But now I can do the actual ones, and I just feel more empowered. I feel stronger. And I try to do something like that probably 4 or 5 days a week. Maybe one of those days might be a hike, maybe a bike ride. But that to me, so I typically do my workouts in the evening time, typically between the hours of 5 and 7. because I just don't have the greatest amount of energy. Plus, I tend to be kind of a night person. I tend to be somebody that can stay up a little bit later, get work done, or get things done around the house. And then I can, do my workouts in the evening time. So for me, that's probably the best self-care. That would be number one. And then number two would be, I walk my talk. I eat really healthy. I follow the paleo diet, and which the emphasis of that is mostly vegetables, fruit, protein, and fat. And then I do limit the grains. I am over 40, and I started noticing when I got into my late 30s, early 40s, that I started putting on weight, and I hadn't changed my diet. I hadn't changed my exercise necessarily at that point, but I started putting on a little bit more weight, which again, I see that with a lot of my female patients. And so I just started cutting back on the wheat for sure, because that obviously is a big sensitive food for me. But I started cutting back on grains in general, and I noticed that my energy is better, my digestion is better, my skin is better, my mind clarity is better. So eating paleo, eating super flavorful foods. I mean, I don't eat plain foods. I love a lot of like garlic and onions and curry and fresh herbs and different flavors. And so, I mean, you can still eat healthy, but it can still taste good and still be enjoyable.
And I think that you and I, we both love to eat good food, right? And we're lucky because we're in the farm to fork capital, right?
Yeah.
And we have a lot of really beautiful food available to us. But I hear a lot from my patients. It's like, oh, well, I don't want to change my diet because, it's not going to taste as good. And I totally disagree with that, because when you actually eat real food and not just like sugar and salt covering up and tricking your brain, it can be, the way that things taste is completely different.
I completely agree. I had a carrot recently. It was just this fresh, with the carrot tops, and I got it from Whole Foods, and I just, I'll shred that and I'll put it over my salad, but I just took a bite of it and it was so good that I ate the whole carrot like an apple, and it was so sweet and crunchy, and it just had so much flavor, and it was a carrot, and it just amazed me at how wonderful it was. Same thing with, and I don't eat a lot of corn, but sometimes if you just eat like fresh white corn where you peel back the, the husk, just biting into that without cooking it, without adding any butter, without adding any salt or pepper, if you just bite into that like an apple or a pear, it is amazing how fresh the fruits and vegetables are. Now, I don't know that I would say the same thing about kale necessarily, eating it by
I love kale.
I love kale too, but I have to eat it with I put it in my smoothie, but I have to mask it with blueberries and almond butter and vanilla protein powder, or I have to cook it in coconut oil. But to eat it plain, I don't know that I could do that.
I'm on a red cabbage kick currently.
Yeah, that's another good one.
Can't get enough.
That's actually as you know, that's part of the brassica family of vegetables, the cruciferous vegetables, the kale, the purple cabbage, the broccoli, the radishes, bok choy, Swiss chard. Those things are obviously really good for us, as most of us probably know, but they're really good for our hormones, right? They have the endo-3 carbinol that our body converts into DIM, which is really great for helping with breaking down our hormones, helping with estrogen dominance, helping support the liver. So for a lot of my patients who, even if they're not estrogen dominant, but I sense that maybe their hormones are kind of out of whack, it's a great source of fiber. They're really good, and they're obviously packed with vitamins and minerals, but they're really good at helping support a healthy estrogen to progesterone balance, but also it helps convert that estrogen into a better, safer form of estrogen as it kind of goes down that pathway. Yeah. And
I'm so high in glutamine, and I'm a glutamine nerd. I think it's good for everything.
Yeah.
Just about, right?
Yeah.
So you have your background in nutrition, and since we're talking about food, when you went through university, did you expect to be a naturopath, or what was your plan with that?
No, not at all. I got my bachelor's degree in nutrition and I graduated in 1996. So, I mean, it was a little over 20 years ago. Um, and back then, the emphasis was still somewhat the food pyramid. So the old food pyramid, I don't know what it looks like now. Maybe
Well,
it's,
now it has stairs.
yeah. So back then, the emphasis was on whole grains, whole wheat, everything. And this was, I don't know if you remember this, but this was kind of the mid 90s where everything was fat free. So
Right.
you had fat free ice cream, you had fat free butter, which doesn't really technically exist. You had fat free chips, you had fat free everything. And that was kind of a trend at that point, fat free cheese. And all that stuff is not very good for you. And as you know, it's higher in sugar and maybe it's got weird chemicals in there. So back then, I remember I was still exercising, but I was eating a lot of grains. I was eating, whole wheat bread and whole wheat pasta and whole wheat cereals. And I was eating a lot of that. And certainly I was able to maintain my weight and I was still exercising, but I was 20, I was 21, I was super young and I didn't have a weight problem. But I definitely started noticing more digestive symptoms. I started noticing more irritable bowel symptoms. And I thought, how can this be? I'm eating healthy. I'm eating a whole wheat sandwich with turkey. I'm making bran muffins with whole wheat flour. How can I possibly have these digestive problems? And I just started, I didn't really start making changes until later in life when I decided to go back to school. So to answer your question, I got my bachelor's degree in nutrition in the mid 90s. And I didn't use my college degree. I actually decided to move back to the San Francisco Bay Area, worked in high tech. I worked at Intel. I worked for a .com. I worked in Silicon Valley and it was great because I was making money and I was back to where I'm from. So I'm originally from San Jose, but I wasn't happy. I was working in high tech and here I had this bachelor's degree in nutrition and I knew I wanted to help people with their health. I've always known that for many, many years. So I worked for about 5 years. And then at the age of 29, I decided to go back to school to become a naturopathic doctor because number one, I knew that I wanted to go back to school. I knew that I wanted to help people with their health. And I knew I wanted an advanced degree. I just hadn't discovered naturopathic medicine until I started doing my own reading on different ways of healing the body. I was having gut issues, as I just said. I also had skin problems. I had really severe cystic acne when I was like 24, 25, which is kind of a later time period for a lot of people to go through that. But I just remember thinking, how is it that I'm going through these hormone changes? I'm well past puberty. So then I just started doing reading on botanical medicine, different ways of healing the skin naturally, different ways of healing the gut naturally. And over the course of probably 2 years of just doing my own personal growth work, I stumbled across, actually, it was a book by Michael Murray, our colleague, and it was the herbal medicine or the Natural Encyclopedia of Herbal Medicine or something, one of those titles. And I happened to pick this up one day. And it said he's a naturopathic physician in Seattle, Washington, adjunct faculty at Bastyr University in Seattle. And I was like, that's it. That's my calling. That's exactly what I want to do. And I had already been kind of doing some reading on it. And the light went on. And I think when you have that, and not everybody has that dramatic calling or that light that just kind of shines on you and says, yes, this is what you're supposed to do. But as soon as I started pursuing that, I got in a year later and I absolutely love what I do for a living. But it took me to go through some of those health problems and those challenges to get me to the start of that journey. Yeah.
And I think that a lot of us have those stories, because it is a bit of a, alternative path. And I mean, functional medicine is kind of incorporating it into conventional, like with as far as Jeffrey Bland, et cetera. But that's still so kind of far out there, right? So we're seeing why do we have complex chronic diseases never getting any better in conventional medicine? Mm-hmm. And so if you do your reading and if you do your research and you look deeper into what the other alternatives in functional and integrative medicine, because we have some really good answers for that, I think.
We do. And, the term functional medicine, of course, that's a heavy, or that's a common term used today, and pretty similar to naturopathic. I mean, it's just a different term, integrative medicine, whatever you want to call it. It's getting to the root cause of why are you having headaches or stomach aches, or why is your skin all of a sudden breaking out with hives, and why are you all of a sudden feeling like you want to scream at everybody, a week before your period. So there's a reason why those things are happening. And as naturopathic doctors, getting to the root cause of why, I think that's what a lot of people are looking for. I mean, so many people are hungry for this type of medical care and hungry for this type of doctor to help them. And, unfortunately, our mainstream healthcare system doesn't allow that. There's just too many people to see in a short period of time, and not enough money. And it's just, it's unfortunate. So I'm glad that people get to choose, right? I'm happy that people get to choose to go to their MD for antibiotics if they need to, or something very, an emergency. And they also have the choice to come see a doctor like you and I to spend more time and do a little bit more testing, right? That their other doctor either isn't aware of, or just simply doesn't have the time.
Or the insurance won't cover it. And so then there's, standards of practice that you can't necessarily deviate from unless you have your own practice, which a lot of, physicians are leaving and hanging their own shingle so that they don't have to just do what the company line wants them to do.
Right.
But as we know, that's not always the easiest way to go.
It's not, it's a big, I think about that almost every day in my practice. And, there are days where I think, wow, it would be nice to go work for an HMO or go work for another clinic and get a paycheck every 2 weeks and have everything that's structured for you. But then I would have to see 20, 25 people a day. And I would have to, quickly hurry them out of my office as I give them a prescription. And some patients need that. They want that. And that works great for them. But at the end of the day, I don't think I would be very happy knowing that I couldn't figure out why they're having, this particular symptom. So I'm trying to be grateful.
That's my favorite part. I think of what we do is kind of like the detective work. Like, right. How do we, what is really going on? And that's where I like the testing and looking at the way that the body's really functioning. What's your favorite part of what you do, or your favorite thing to treat, or whatever?
Well, I love talking to people about, I have to say my first foremost love is nutrition. I have to say that I love talking to people about, I had 2 patients in my office just this morning who are wanting to lose weight. And I have every patient fill out a diet log that kind of says generally what they typically eat in a given day for breakfast, lunch, dinner, snacks, and desserts. And it's amazing how many people eat Oreos or which I used to love Oreos, by the way. That used to
100%.
My favorite cookie. Yeah. But it just how many people eat a lot of sugar and baked goods and sandwiches and cereals. And I used to be that person. I used to be that person that used to eat pizza and bagels and Honey Nut Cheerios, which I used to think were good for me, right?
I miss cereal more than anything else, I think.
Yeah. And so, but yeah, I get people in my office and they're wanting to lose weight. Getting to talk to them about eating more vegetables and less of the sugar and less of the refined carbs and more of the paleo diet. So that would be my first thing. And I love seeing how much better they feel. Their digestive symptoms resolve. They're less constipated. Their skin gets better. Their energy is better. The weight goes down. And usually that's a very, very easy way for patients to be happy is when they start dropping weight. If they want to, it makes them very, very happy.
Right.
But also, being a naturopathic doctor, we have a lot of things in our toolbox that we can draw upon, and we can recommend herbs, we can recommend botanicals, nutritional supplements, in some cases, homeopathic remedies for some patients. And then, of course, there's the physical hands-on treatment, which I don't do a lot of in my practice. I know a lot of our colleagues do, like prolotherapy and PRP, and there's all sorts of other muscle and, joint work that some of our colleagues are doing. And so just looking at the body, obviously in a holistic way, and giving the patient different recommendations that are going to help them feel better. I think that's, and people like choices. I think people want to know, what are my choices? And for some people, like I had a patient this morning, she had what she thought was a head cold, or she thought it was like a respiratory virus coming on. And when I asked her some symptoms, it turns out she's probably having a bacterial infection, like a sinus infection, based on her symptoms. And so I thought, okay, well, I'm going to give you some recommendations that you can do based on what I think would. Some people need antibiotics. Some people need to go to the ER. Some people need to go to see another doctor who's going to be able to do something that's going to be life-saving and immediate. And so that's the benefit of being a naturopath, is you don't get to choose one healthcare modality over another or one healthcare direction. It's really just knowing about what's best for the patient. And that's what I love.
Yeah. I like the idea of choose your own adventure.
Yeah.
And do what works.
Yeah.
And I have a surgeon friend that I really enjoy talking to about it. And he's like, well, if you end up in the emergency department with a heart attack, all bets are off, right? Like you need that intervention. I mean, it's not that is not the time to, eat more kale or, right? There is a time and a place. And I think the beauty of what we do is we do so much prevention. We do so much integrative, how do you span the spectrum between, wellness and illness, and extreme illness where you need drugs and you need surgery and you need those life-saving interventions. And yet there's so much room in between there to help the body work better.
Yeah, and I see it in my patients. I see it in my own life. There's times where I've needed antibiotics and I just thought, no, I'm not going to take it. But there's times where I absolutely needed to take it. There's times I've needed to go to the ER. There's times I've needed to go to urgent care. And there's times where I've needed to go see my primary care doctor once or twice a year. I mean, that's really the beauty of healing the human body, is you do what's best for the body. And whether it means, doing things naturally, more gradually, or doing things immediate, I just think you need to know, you have to know what to do and what's best for the person. Yeah.
And so have you been, we're in a book club kind of together. Have you been reading anything good?
Am I reading anything good?
I've been reading a lot of steampunk sci-fi. So take that with a grain of salt. It doesn't have to be.
Right. I listen to a lot of audiobooks. So for me, you and I both do a lot of reading. So I listen to audiobooks before I go to bed at night. I find, like, on audible.com, I find that helps calm my mind. I mean, I wouldn't be listening to a Stephen King novel or anything frightening, but just something. I tend to gravitate towards more the personal growth books on just ways to cope with life and how to be happier, and acceptance and self-compassion and mind-body medicine. I'm a big believer in mind-body medicine. It's not just about eating healthy and exercise. It's your thoughts and how your thoughts can help shape your reality and shape your life and bring the things that you want, and in some cases bring the things you don't want. So I tend to listen to books like that are very positive and uplifting, and very balancing for the soul, balancing for our emotions, of course, and our psychological state, but also balancing for the soul. And for me, that helps me feel calm, and it helps me feel balanced, and it helps me sleep better. Yeah.
I think I love the idea of the mind being able to overcome everything. And I do think that it can. I had a very bad car accident, and I ended up healing the injuries from it 3 times faster than ever expected. And people are like, well, how did you do it? And of course I used functional medicine, right? Like, I gave my bones what they needed to be able to regenerate. But every night I visualized those, bones knitting together every single night. And I think that when you do both, when you do all of it, when you do the mind, the body, the emotion, the spirit, and you do it all together, that's going to ensure much more success faster. I think that they all work well when you do them by themselves, but if you do them together, it just makes everything come out a little bit more?
I think it does. And it's hard for people to fathom, oh, what I think about, I bring about. But, I've seen this happen over and over again. I was really worried about something recently, and I just kept, verbally, affirming what I wanted, and I kept picturing it happening, and sure enough, it did. And it's like, how did that happen? It's something that you can't prove in a clinical trial. I mean, it's just something that happens, and I'm a big believer in we're all connected, in a spiritual way, I believe. And when you start practicing that in your life, in addition to the physical things that you're supposed to do and the nutritional things you're supposed to do, that's when you really start to see even more profound effects on your health, like you envisioning your bones healing and your body healing. And I think anybody can do that. I mean, it's, we're all human. Everybody has that power and that capability, and the brain is amazing at what it can do.
We don't even have any conception of everything with the brain.
Oh my gosh. It is, I had a bike accident recently. I fell off my bike and I landed on my head. Unfortunately, I didn't have a helmet, which I will never make that mistake again. But I fell and I was knocked unconscious, and I saw flashes of light. This was recent. This was like a month ago. And I was so scared that I had done permanent damage to my brain, and I just jumped right on that. I did have to go to urgent care. But then right after, I took a bunch of supplements. I continued my self-care. I got massages for all the muscle aches that I had. I put really good healing ingredients on my wounds. And a month later, I'm so much better. And I've done a lot of things, both conventional and naturopathically, to heal my body. But I thought, the brain is amazing at what it can do. And if if there is some sort of injury, it is reversible. Obviously, repeated injuries are not necessarily. That's a little bit more severe. Anyway, my point is that I took every approach, and I did do a lot of mind body medicine to try to heal my brain, to heal my body. And but yeah, the brain it's a very sacred organ, and we need it obviously for everything. When you take care of that as well as the rest of your body, I mean, yeah, it's unlimited.
My brother is also a naturopathic medical doctor, and he developed a concussion supplement. I don't know if I've told you about it, but he put 4 main ingredients into it for specific, like repeated sports injuries. Yeah. And so I'll have to get you some of that.
Yeah, I mean, like lion's mane and acetyl-carnitine and I mean, there's so many wonderful ingredients in products that I've started using now, and I believe they're helping. It could just be that the body is resilient, like we talked about earlier.
Well, yeah, but I mean, I think that when you give the body what it needs, it does better.
It does.
Right? And resiliency comes from energy and that sort of thing, but also the building blocks of what we build ourselves out of.
Absolutely. I completely agree. Yeah. And we have the resources and the knowledge and the websites to refer patients to get these supplements or in our own practice.
We're almost out of time. So why don't you tell everybody how they can find you if they're in the area. And I'm really happy to have had you on today.
Yeah, thank you, Heather. It's great to be here. So my website is Dr. Kristi. It's DoctorKristi.com. My email address is on my website as well. And I do phone consultations too. You don't have to be in the Sacramento area.
Wonderful. Well, thank you for being on, and I'll see you soon. We'll have to get some wine.
Yes, for sure. Yes. Nice to see you, Heather.
Bye-bye. Thanks for being on. We'll see you next week. Fridays at 2, every Friday at 2, we have the Bad Girls Guide to Living Well, and we'll see you next time.
Thanks.